If you have had breast cancer, should you get your information from social media? Well, in this video, that's what I'm going to be talking about. If you have been diagnosed with breast cancer, or you are someone who wants to learn more about the disease, it is very likely that you would have gone to the internet to find out more information. You are watching this video, for example, which illustrates my point. Dr. Google suddenly becomes a very good friend, and it is the place that people seek out all the answers to their different questions. The thing is, it's impossible to know how accurate or reliable all this information may be. And not only that, the language used may be either too technical or too lengthy and verbose, and not particularly easy to digest or understand. So another place people go to is social media. Now, social media is defined as many things, but in essence, it includes any web-based platform that can be used for social interaction. Generally, when we think about social media, we think of platforms such as Facebook or Meta, Instagram, Twitter, TikTok, and to an extent, LinkedIn, YouTube, and WhatsApp, amongst others. So why do people go to social media to obtain health information? Well, it's because it's easily accessible, provides peer support, and you can also be anonymous should you wish. As a result, patients are able to talk more freely about sensitive conditions in their online communities, potentially with fewer barriers than a similar in-person or non-virtual community. And because the global reach of social media is so vast, it means there is a wealth of information and experiences that you can gather and share. Patients have numerous opportunities to find a community that suits their needs. The interesting thing is, it's been shown that patients use social media not to ignore or dismiss the information given by the healthcare professionals, but instead, they use the information to complement and fulfill the needs unmet by their healthcare professionals. In addition, it has been shown that patients become empowered when they use social media for health-related purposes. It helps patients better understand their disease, and it improves engagement with their healthcare providers in their decision-making process. So, what are the pros of social media in the context of helping those affected by breast cancer? Easily accessible, I've mentioned before, and again, anonymous, so you can choose not to be publicly visible if you wish. Of course, it's also free, so, cheap and cheerful. It provides support from other people who have shared experiences and provides a sense of community. Social media can educate. You can learn so much on social media, and not only from experts in the field, but also from the experiences of those who have been through the same diagnosis and treatment. And social media also allows friendships to blossom. These online connections very often morph into offline connections, and many people eventually meet up in person, either through events or personal meetups. So, when used correctly and intentionally, social media can be really used for the good. Now, there can be downsides too. It can be emotionally triggering. Certain posts or conversations may evoke thoughts or events that may bring back certain challenging and difficult emotions. It can be competitive, and people compare diagnoses from one person to the next. Occasionally, people may think that, because you didn't have chemotherapy, for example, then your experience is less important than somebody who had chemotherapy. So sometimes people can compete to see, who has had the worst breast cancer treatment and diagnosis. It is important to make sure that you follow people you can trust and who are actual experts. And social media can be overwhelming. It may be too much information to take it all in. But despite the potential negatives, social media, when used purposefully and deliberately, I personally think provides so many benefits to patients who have had breast cancer. The ability to connect with peers allows learning opportunities by exchanging stories and experiences. Patients can help direct each other to reliable information. They can share tips on how to manage emotional and physical stresses, and they can also benefit from shared strategies on how to move forward. It can also create space for emotional and psychological support, where exchanging stories and experiences between patients can be extremely useful. We know that patients who undertake self-advocacy report improved quality of life. A cancer diagnosis can be lonely and an isolating experience, and the community aspect of social media can be beneficial for patients for social, emotional, as well as network support. The wealth of experiences and stories shared in online communities can improve knowledge, whilst at the same time reduce anxiety surrounding a breast cancer diagnosis. The other thing is, the opportunity to interact with verified healthcare professionals on social media is another benefit, not only for patients but also for healthcare providers. Engaging with online communities has been shown to empower patients to engage better with their healthcare professionals, and it enables a more equal partnership between patient and care provider. Increasingly, healthcare professionals are realizing the power of social media and using the accessibility and reach to disseminate public health messages and information, and also engage patients in academic endeavors. However, as mentioned, there can be downsides to social media. Misinformation and increasing negative emotional burden are experienced by many who use the platforms. The addictive nature of social media can also be considered to have a negative impact on mental health. The thing is, social media is here to stay, and the relationship between social media and dissemination of healthcare information, it's only going to grow. As more people continue to seek information online, it is vital also that healthcare professionals engage with the various platforms to ensure quality information is shared and patients feel empowered in their healthcare decisions. If you use social media, let me know in the comment section below, and I'll see you in the next one.